Hi, I'm Tony Nichols, and welcome to Chamber Chat. Well, hi, and welcome to Chamber Chat, a program put together by the Salisbury Area Chamber of Commerce to keep you informed on what's going on in your chamber and in your community. Joining us as our first guest on this edition of Chamber Chat is Ashton Donaway, founder and executive director for Mindfully Anchored. Welcome to the program.
Thanks. Thank you for having me.
So the name sounds cool.
Thank you.
Mindfully, I'd like to think that I was mindfully anchored, but there are times that I feel that I am not. Tell us what that's all about.
Well, actually, we started about a year ago, and the reason I got interested in sort of a technique to calm our household was because we had a very hectic lifestyle going, and I started to notice that my kids were mirroring my behavior of being very fast-paced, high stress level, feeling like we had to be going all the time. My oldest stepdaughter was diagnosed with ADHD, so she was having trouble, calming herself down too. So I did some research and I came upon mindfulness, which is just a practice of being presently aware of what's going on. And through regular practice, your brain becomes more able to do that innately without having to tell yourself to calm down. So it brings improvements in focus, attention, all that sort of thing.
I would 100% agree with those kinds of skills and habits are learned. But holy cow, we should have been mindfully anchored when my 26, 22, and 17-year-old were growing up, because they were all the things that you described. So what if, by putting these techniques in practice, what kind of results have you seen? Now, I mean, has it been done in classrooms? I know you certainly has been done in your home, and maybe the effects that you've seen in your children.
Yes, well, I started the organization kind of really not knowing what I was going to do with it, but because of what I had seen in my home, I felt like I really needed to share these techniques with other people because our entire family dynamic changed.
Sure.
There are 6 of us in the family, and each member of the family will tell you that when we started practicing mindfulness, a lot shifted. We've just kind of created a climate of calm in the house, which in turn gives you a climate of calm in your mind.
I'm thinking that the word that I keep in my mind is being intentional.
Absolutely.
So many times I talk to business owners and I'll talk to people, and I'll tell them to be intentional about what they do. Have a goal in mind and be intentional in your steps to get that goal. Is that a similar analogy?
Absolutely, that's spot on. What I teach the kids, and of course now it's gone into adults as well. You have to be intentional with your thoughts, because your brain will, through neuroplasticity, your brain is actually able to it physically changes based on your experience.
Sure.
The way it works is like a muscle. The more you think one thought, the more your mind is going to think that thought. So if you're more intentional with what that thought is, you may not believe the thought when you first start thinking about it, but the more intentional you are with what goes on in your mind, the easier it is for you to have the results that you want.
I would think on the reverse side of that, the very same thing happens in a negative way.
Absolutely.
When you feed your mind and your brain with whatever it is. I mean, there's so much junk on the television today, except for Chamber Chat. There's so much junk on the television today, or on the internet, YouTube, all these people that are becoming millionaires by doing just stupid things. You fill your mind with enough of that, then you begin to have those attributes showing up in your own life.
100%, I agree with you.
So what are your benefits? What are the benefits from this type of programming?
Well, as far as what the kids benefit in school, because that was our original focus,
Okay.
and I have taught a few, it's a 16-week curriculum, 15 minutes twice a week.
Okay.
So it actually keeps your attention for that amount of time.
Yep.
And the benefits in the classroom, again, is that same feeling of a climate of calm. What they also experience is through regular mindfulness practice, there's a reduce in truancy, test anxiety, stress level, improved ability to focus attention intentionally. I mean, endless benefits. What I like to talk about, because I get passionate and I do believe the benefits are endless, I like to talk about the behavioral changes that align more with feelings of love, joy, peace, patience, kindness, goodness, gentleness, and self-control. That's really important to me, and I feel like that's kind of all-encompassing, and then of course the physiological changes that come along with that are of benefit as well.
Yeah, it ties into your health and every aspect of your life. Have you found that there is a particular age group that it works better in?
I personally, the younger the better. My youngest now is, he'll be 2 in April, and you'll see him take a mindful breath before he throws a temper tantrum.
Really?
My 4-year-old will say, "Mommy, I think you might need a mindful breath." Or she'll come and say, which I wouldn't recommend because I don't get excited when she does do that, but she's right. She'll also do things like say, "Mommy, I think I need a time in," rather than lash out. And I think that's amazing. Now, us as the adults, we have it a little harder because we weren't taught these skills.
Right.
So I would say the littlest kids are the easiest.
Right. But I'm of the opinion, though, that old dogs can be taught new tricks.
I'm proof of that.
But I'm wondering how my staff, when I go back to the office, is going to react. I'm wondering how they're going to react when something's going wrong and I tell them out of the blue, you need a mindful breath.
Well, I'm a firm believer in practicing what you preach, and that's not the easiest thing to do. I don't always get it right.
Sure.
But I would just, in that case, I would do something like just exemplify that. You don't even say anything about it. My kids just see me take a mindful breath.
I think that goes back to what we just talked about. Even when we don't get it right, even when our kids might not get that right in the thought process that you're trying to employ here, it's the intentionality behind it. It's the goal. We're going to fail, but you know it's okay, because we'll get to the point where we're succeeding more than we're failing.
Right, and it's a practice. That's important to remember.
It's almost like I work for you.
Would you like to work for me?
Yeah, it's
I can't
good.
pay you.
I
but you're invited.
absolutely agree with the concept though. So what are some of your goals for the next year?
Well, like I said, we started on a small scale, just me going into the classrooms, but the response that we've gotten has been so encouraging, but much more than I can handle on my own. So we've created a board of directors, and we've got a couple events coming up. We're going to do the March of Dimes walk. We're going to make a mindfully anchored team, which of course any money we raise from that goes to the March of Dimes. Our first larger scale fundraiser is a Cinco de Mayo golf tournament. There's sponsorship levels available for that. I believe that I never want to charge an institution for us coming in and doing the curriculum, because I believe the kids that can benefit from this the most sometimes are maybe in schools that can't afford to bring in a program. Yeah. So I would like to operate solely based on fundraising. We'd also, because like I said, the community has really expressed that they would like more of this, we would love to be able to raise the money to get a studio, maybe downtown where we can get some exposure and really help some people.
So if some of the Chamber Chat viewers wanted to get involved, or the community wanted to get involved and help, how can they do so?
Please like the Facebook page. That's very important to me, because I think I do a pretty good job of keeping it updated with the latest research and any community events that we're going to have here in Salisbury. Come to those events, spread the word, share a post if it touches you in a certain way, and get in contact with me for more information.
Actually, thanks for coming in and talking with us on Chamber Chat.
Thank you so much for having
Hopefully
me.
we'll get Salisbury mindfully anchored.
Absolutely.
We'd like to thank you for this time. Now we'd like to give you the opportunity to take a look at the upcoming events with the Salisbury Area Chamber of Commerce. Welcome back to Chamber Chat right here on PAC 14. Joining us now is Vice President and Chief Business Officer of PRMC, Chris Hall.
Well, thank you, Tony.
Welcome back, brother.
Yeah, I appreciate it.
It's been a while.
It has.
You're the professional Chamber Chat person now. So the last time we talked, or maybe a couple of times before when we talked, we really talked about a lot of the changes that the healthcare industry has been undergoing in the past several years. But more specifically this time, I think we want to dig into how PRMC has tackled that change. I think you guys were at the cusp of starting some development towards that goal.
Yeah, the last time we spoke, we were talking about how healthcare, the industry in total, was changing dramatically. And
right.
we were at the forefront of that. And we were trying to understand the way it was going to evolve in this dynamic environment. And since then, we've created a new Vision 2020 for the hospital, new strategic plan, and where we see ourselves. And it's really into three major components. It is Peninsula Regional Medical Center. We are the 9th largest hospital in the state of Maryland.
Sure.
In bed size, we have 90,000 ER visits coming in every year, about 1,500 trauma, the first open heart provider in the region, the first doing Da Vinci robots, et cetera. So we've been at the cusp of that. So that's the hospital. We're also about population health. How do we get into the community to teach people to stay well, and if they have a chronic condition, how to manage that so they don't use hospital services? And then the last piece of that Vision 2020 is about getting out into the ambulatory world, making sure we provide the right care in the settings that are most appropriate and less costly for individuals, so that they, again, won't have to come back to the hospital, but they can receive it closer to and more convenient to their home.
Yeah, that's a lot to bite off in terms of digging into. But
if you have 1 hour, I can go through each one.
Well, exactly. Well, I do want to dig into one. You talked about the technologies,
Sure.
the technological aspect of healthcare. Can you dig into those a little bit more? Because I think that always intrigues people.
You know, Peninsula Regional Medical Center has been around for 118 years. We've been honored to serve the community since 1897. So since then, you know, people come to know us for the emergency room and the trauma services, but in delivering of babies, we deliver more babies than any other hospital in this region combined. So we take that as an honor and a privilege to work with the community. So we'll continue to provide that. At the medical center, we'll continue to work on quality. We are one of the best in the quality indicators, what they call MHACs, Maryland Hospital Acquired Conditions. So if you come to the hospital for a specific procedure, you don't want to get something else. Right. And if you look at all of the 64 measures that they have under MHACs, we rank very high in the state. So we continue to work on quality because the consumer and the patient deserves it. Secondly, work on the experience. The Ritz-Carlton has a process, and they're known for their service at their facilities, at their hotels. And what we've done is we partner with them to say, how do you do it? What are the principles that you follow? We're not a hospital, but if you look at the word hospitality, the first few letters is hospital. Right. So we partnered with them to understand how they do it and what are the principles, and we're working with our team and our staff on that. We'll continue to look at other ways to engage our employees. But also we're looking at ways to make sure that we are cost effective for the community, and we'll continue to grow our services. But you asked about technology. A great example is while we in 1974 did the first open heart, just a couple years ago we did the first TAVR procedure. You don't find that procedure, and I'll explain in a minute, outside of academic medical centers. And here we have it on the Eastern Shore. And before they would have to open up your chest, they have to replace a valve in your heart. Okay. Now they can do it through a vein. They can go up in the vein and replace the valve. So just an example, you know, Da Vinci robots in 2007, we brought the first robot procedures here to the shore. People can go home the next day. Before they had to stay 4 days in the hospital to recover.
You must have saw my eyebrow raised when you named the surgery. Then I had to explain it. So I'm sure your eyebrows raised too if you're not in the medical industry. But that's absolutely impressive to have that right there on the shore.
We have a gem here on the shore, and it's you know, for a privilege to work with such an organization.
Yeah, some the documentation that I have reviewed talked about population health.
Yeah, that's the second part of our
So
Vision
what does that mean? I know what I think it means.
Yeah,
but
and it's just that. It's the health of the population. So while we are a medical center, all Maryland hospitals and health systems are charged with taking care of the communities. So it's a little bit of health and wellness. How do we keep you healthy and well if you already are? But if you do have a chronic condition like diabetes or congestive heart failure, how do we manage that and provide the right resources for you so you don't become readmitted into the hospital?
Gotcha.
So that's, you know, we want to keep them out.
I would think a part of that too is educating people on, you know, exercise, health. You know, the standing joke is, you know, the doctor tells you to stop smoking and lose weight. quit eating fatty foods, all those things. But that has to tie in when you're talking
It
about
is.
population health.
It's a multitude, and guess what? We can't do it by ourselves. So
Right.
we will be out there partnering with other organizations that do this and do it well, and making sure that from the early ages, in early school, working on health literacy. How do you teach kids to read a food label?
Sure.
Make smart choices so that they don't go out and start smoking or start eating the fast food, but they can make that healthy choice up front. But then if you have that chronic condition, how do we manage you so you don't have to come back in? And that's
And
the whole
can you
purpose
change
of
the
it.
diet to help? You know, certainly there are many times where medication is a necessity, but sometimes the medication with the change in diet or habit can get you to the point where you can come off the medication.
Yes.
So those kinds of things I think are maybe it's number 2 on your list, but that's a big step in terms of becoming the hospital of the 21st century.
Yeah.
that we've talked about a couple of times.
While if you need health hospital care, we'll be there for it, but
Right.
we'll also have to maintain your health.
Right, exactly. The role of the hospital is changing.
It is.
We've talked about that, the last time we spoke on this subject. Ambulatory surgical centers are everywhere now, and I think with in the previous segment we talked about intentionality. I think that's intentional because of the dynamic of healthcare. Am I right there?
You're absolutely right. You know, the ACA, the Affordable Care Act, came out in 2010. It said that you need to improve the quality of care that you're providing to the communities. You need to improve the experience people have, and in a lower cost setting. So the third leg of our Vision 2020 is to get out into the community where people live and provide the services that are appropriate for wellness, but also if they need healthcare services closer to home. A couple of great examples that you've seen recently since we talked last. Millsboro opened up, and that's a 50,000
Yep.
square foot office building with multiple services, specialties, primary care, et cetera. Ocean Pines just recently opened up the first building, and that's a 20,000 square foot building in the north gate of Ocean Pines, where we consolidated existing services we had down there, but we're looking further what else can be provided.
Sure.
So the residents don't have to travel all the way to Salisbury. So you'll start seeing these outposts of services. Just this month in February, we opened up the Peninsula Breast Center, where we consolidated care into one location for women to help reduce the anxiety of waiting for any kind of results. Here's a center where you can get 3D mammography, the latest technology.
Sure.
You can get your biopsies, you can visit with a surgeon, and you can visit with others in consultation in the same center. So you're not running around town trying to navigate the care.
I know I'm going to ask, what may sound like a silly question because I know the answer, but I want to ask it anyway. Are you finding that the ambulatory surgical centers are very well aware as to when it's time to refer that to the hospital, whatever that
Yeah.
condition is, rather than treat and think about it? No, you need to go to the hospital.
Yeah, it varies. Like for instance, in Ocean Pines, it's a primary care physician practice, so that's something that's been existing. But if you go over to the Peninsula Breast Center on Snow Hill Road, that is usually care that would be done in an outpatient center. But if
Right.
the physician sees that, hey, this is something we can't handle in this center, even though we have operating rooms and procedure rooms as part of it, they would refer that and they would take a case back to the appropriate setting. If it's a hospital, then so be it.
Right. Well, I know this is not the first time you've been asked this question, but let's break out the magic 8 ball or the crystal ball
Crystal ball.
and let's look out and what's the future? What's that
You know,
look like?
I kind of sarcastically say my crystal ball is as clear as the Mississippi Delta, because healthcare is consistently changing. I grew up working on healthcare services, hospital services, making sure that what we provide is what the community needs. But like we've been talking, it's more moving outside the walls of the hospital. And I think you'll continue to see that. Hospitals, will they go away? Absolutely not.
Right.
We'll still be providing emergency room services, still delivering babies. We'll still provide operations, and you'll have, if you need acute services, you'll have a bed.
Sure.
But I think they may get a little bit smaller, more acute than general medical care. And some of that stuff will be managed out into the community in the appropriate setting. You'll start seeing, for instance, we had the Wagner Wellness Van, which was a van that went out and just did screenings and different events. That's turning into a mobile clinic. And we're actually going to park that in certain areas. 20 days out of 30 a month, we'll be out in the community providing clinic
That's
care in locations. So individuals who don't manage their health don't end up in an emergency room.
Sure.
They can actually go to a provider.
That's awesome.
So those are the kind of things you're going to see more. So the care will be out in different disparate locations. But again, if needed, we've been serving it for 118 years and we'll continue to provide great hospital care, but also that and other medical care in the community.
Chris, it's always a pleasure to have you on Chamber Chat. And if you ever want to come back and get a little deeper into any one of those subjects, just let me know. You're welcome here anytime.
Thanks, Tony.
We'd like to give you another opportunity now to take a look at the upcoming events for the Salisbury Area Chamber of Commerce. Welcome back to the Chamber Chat right here on PAC 14. Joining us is our own Director of Media and Public Relations, Sophia Smecker with the Chamber of Commerce. Welcome to Chamber Chat.
Hi, Tony. Thank you for having me. I feel like I'm a veteran at this
You
one.
are a veteran at this, and normally when you are sitting in that chair, there's really something cool going on, or there's food involved, and this time it's all about the food.
Yes, definitely.
So the second annual Restaurant Week coming up, is that it?
Yep, it's coming up. That's going to be April 11th through the 17th. Yeah, second annual.
So I was a big fan of that last year. I think the word that we coined was a foodie.
Yes.
But where did the idea come from? I know that last year was the first one, but where did the concept or the idea, or why have a Restaurant Week?
Well, Restaurant Week is an opportunity for restaurants to kind of highlight and showcase their menus and their chefs. The concept of Restaurant Week is the restaurants in Wacomico County will offer a 2 to 3 course fixed price menu. So they can offer appetizer, dessert, entree, all for one price, lunch or dinner. This year we're going to be having restaurants do some drink pairings as well. Gallo Wines is the featured wine Restaurant Week this year, so they'll be doing some fun pairings.
Very cool.
Yeah.
The idea of highlighting local restaurants is awesome to me because, typically speaking, that's where you get the best food. When you go on vacation, you want to find the people that are local and ask them where to eat, because it's not the big glittery signs flashing. It's the little hole in the wall restaurant over here sometimes, but the food is just out of this world. So many times, that's what I find when you do Restaurant Week. I had no idea the food was good this year. I had no idea the food was this good here and wherever here is.
Right.
How does it benefit the restaurants?
Definitely benefits the restaurants because the chefs are able to highlight their culinary talents and showcase their menus. They may offer something that they've never offered before. It gives people an opportunity to come out and to try. And foodie or not, I think everybody can appreciate a creative and delicious dish. Yeah,
I certainly can. So how does it, outside of that very last statement there, how does it benefit me? How does it benefit the restaurant goers, the people that are going to be dining?
Right. Well, it gives you an opportunity to maybe get out and try a restaurant that you never tried before, or maybe a restaurant that's new to the area. And you can also take advantage of the opportunity to get out and get a little more bang for your buck. The 2 to 3 course fixed price menu is definitely a great value and a low price for everything that you're going to be getting.
If this thing catches on like it seemingly already has and continues to grow like it does, this could not just benefit the restaurants, the restaurant goers, but it could be a pretty big impact in the community. How so?
Well, there's been a huge buzz going on in Salisbury, and I think people from neighboring counties, Berlin, Ocean City, those towns, they're coming because they're hearing the buzz of what's going on in Salisbury.
Right.
And I think this only adds to that cultural momentum. We want Salisbury to be a tourism destination and people to come and visit our attractions, eat at our restaurants, and contribute to the local economy. So this is just adding to that.
Sure. What kind of restaurants can we look for? You got to give us a little sneak peek.
I can give you a sneak peek. Yep. So far we have on board. I'm just going to name a few. Last year we had
Well, you can't give us
28
all of them.
restaurants.
Yeah.
Yeah, we had 28 restaurants that participated last year, which was great for our first year. Coming back this year, we have Irish Penny, Market Street Inn, Evo Public House, Brew River, Tall Tales, Adams Tap House. So definitely some great selections.
Yeah, that's enough. That's enough teaser that you could stop there, and we could just have that for 1 week and have another 6 or 7 for the next week. We could have a restaurant month.
Yes.
Hey, there's a thought.
Yep, lunch, dinner, every day during Retro
What
Week.
is there anything new this year? Is it just same old, or are you adding a twist in there?
We are definitely adding a twist this year.
Okay.
We're going to be having a kickoff party. It's going to be on Thursday, April 7th. It's going to be 6 to 8 at headquarters live. I'm working with Breakthrough Beverage on that. They're going to be doing wine tastings with the featured wine of Restaurant Week. And restaurants are also going to be bringing in samples of their dishes. And they're going to be showcasing their menus for the following week. So it's going to get people very excited to go out and dine. We're going to have live entertainment there and some giveaways, some gift cards for the restaurants.
Very cool.
Yep.
We look forward to it. How can we stay updated, and where can we find more information? Maybe a few more of those restaurants you're talking about.
Yes. Continually check out the website, SalisburyRestaurantWeek.com. And we're also on Facebook, Twitter, and Instagram. So we'll be posting all kinds of food pictures, the restaurants that are going to be
Of course you will.
participating. We're going to be updating the menus. And then we have a partnership with iHeartMedia and Froggy 99.9. They're going to be doing some giveaways on Whiskey and Randy in the morning all throughout the week before Restaurant Week. So you can definitely stay up to date a lot of different ways.
Very cool. Sophia, thanks for coming in on Chamber Chat. You're always welcome, especially when we're talking about food.
Thanks for having me, Tony.
We'd like to thank you for joining us on this edition of Chamber Chat. And as always, if you'd like to see portions of this episode that you may have missed, or you'd like to view previous episodes, we'd encourage you to visit PAC 14's website or the Salisbury Area Chamber of Commerce's website. That's all the time we have for this edition of Chamber Chat. My name's Tony Nichols, your host, encouraging you to make a difference.